right, that looks really easy to make at home, right? So you're going to be able to try that salad in just a couple hours after the presentations, and you can put it to the test if you like it, and then you can make it at home. All right, so next up we have Dr. Dave Donohue. Dr. Donohue is Delaware's first board-certified lifestyle medicine physician and is the Chief Medical Officer at Progressive Health of Delaware. He's also the Director of Lifestyle Medicine there and will be presenting today on heart health. So please welcome Dr. Donohue.
Thanks a lot, Maggie, for letting me go last after those other two presenters. Jeez. If everybody wants to go to the bathroom right now, might be a good time. So that's our practice, Progressive Health of Delaware in Wilmington. We were elected the top medical group in the entire Philadelphia region last November. We're very proud of that. I think it's because we're a lifestyle medicine practice and we spend a lot of time with our patients. So that's me, my credentials. Essentially, that's all you need to know. I eat a big salad every day. No trouble getting that fiber in. And I recommend that you do the same. Get those greens. They are among the healthiest foods we can do, certainly for our heart. And that is our first heart healthy tip of the lecture. And we will have 10 more heart healthy tips. But big salads, we give that Gladware container, half-gallon container away to each of our participants in our disease reversal programs like Cure Diabetes. And we say, fill that container with salad or vegetables. We want to give you a visual cue and a tool. Big salads every day. Those greens are super healthy. And what else is in there? Red onion. And I have broccoli sprouts in there, which is highly cool, and you can do it yourself. That's another topic. My funding, I receive funding from these organizations, Big Broccoli, the Garlic Growers, and Mushroomers. Just kidding, these organizations don't exist. And so you don't have the commercial influence in these talks today. I'm going to talk about heart disease. So heart disease, there's basically, I would say, 3 kinds of heart disease. Arrhythmia is a problem with the electrical system of the heart. If you know someone with atrial fibrillation or a pacemaker, that is an arrhythmia. I'm not going to talk much about arrhythmia today. The other kind would be congestive heart failure. That's a problem with the pump itself, how well it's squeezing, how much of that blood is it moving along. Congestive heart failure, I'm not going to talk as directly about that either, but suffice to say that the lifestyle factors I'm going to talk about today for cardiovascular disease very much influence our risk and mortality rate from congestive heart failure as well. I'm going to spend most of my time talking about cardiovascular disease. Now, what is that? Blockage. In a word, it is blockage of the arteries of the heart. It's a problem with the plumbing system of the heart. So the blood supply to the heart is what? What kind of tissue is it? It's muscle. And just like the muscles of your body, it needs a blood supply. And when that blood supply gets choked off, that's cardiovascular disease. So let's say you have a friend, Jorge. Okay, Jorge has been getting some chest pain. It's kind of been going on a while, let's say 2 months or so. It started just once in a while, particularly when he exerts himself. Sometimes it's down in the tummy and sometimes in his back. He doesn't know quite what's going on. Sometimes a little shortness of breath. What are you thinking about? What do we call this symptom when you're getting chest pain with exertion? Angina or angina? What's that? Indigestion could be. Could be. It's on the list of possibilities, but we're worried about angina. Jorge is certainly worried about it. That blockage of the arteries that Dr. Barnard mentioned. So a normal artery on the top, that's the way our arteries are supposed to look like, and they looked like that at one point before we started clogging them up, but most of us have some degree of blockage in that plaque, as we see in the bottom. And what Jorge is really worried about is if those arteries get blocked all of a sudden, and what's that called? Heart attack. And when you block that artery, all that muscle tissue that artery supplies can die all of a sudden. So we don't want that to happen. And just so you know, this is not just a Jorge problem. This is an everybody problem. And as our good friend Dr. Michael Greger tells us, the choice is not whether you want to eat healthy to prevent heart disease, it's whether you want to eat healthy to reverse the heart disease you already have. So we almost all have, I shouldn't say almost all, the majority of us have some degree of heart disease. So that's our second heart healthy tip, is to recognize that, don't wonder, do I have heart disease? I don't want to have heart disease. You have heart disease, and most of us, and you want to reverse it, or you want to prevent it from getting any worse. By the way, another heart healthy tip I'll say is go on nutritionfacts.org, click that link, subscribe, because this is a wonderful resource for learning nutrition science information. It's been super helpful for me. Yeah. Now, it's appropriate to be worried about heart disease because, as it was said earlier, it is our leading killer, and there's heart disease in the blue and cancer in the red. Cancer's catching up, but heart disease is still a big killer in this country and internationally. It is our leading killer internationally, and you see stroke number 2, so these vascular diseases are very much leading the way of death in the world. So what is Jorge going to do? Well, he figures, I have a heart problem, let me go see a heart doctor, also known as a cardiologist. Makes sense, right? She's the specialist in the area, so like any professional, she's got her toolbox. So she's going to go to that toolbox. Well, first she's going to run some tests, and she's going to do probably a stress test. Okay, and she might do one of a variety of kinds of stress tests, walking on a treadmill, checking an EKG, et cetera. And the stress tests often give us helpful information, equivocal information at times. Well, let's say this suggested, yeah, you might well have some blockage. We're concerned. So Jorge is terrified now. He doesn't know what to do. And he feels like it's an emergency situation. So what is the cardiologist going to pull out of her toolbox to address the problem? First thing would probably be drugs. And this also goes for if you go see your primary care doc, internist, family doc, etc. We all have the same toolbox to a large extent. So the drugs, and we have drugs for blood pressure, we have drugs for high cholesterol, we have drugs for diabetes. And these drugs work very well. Guess what they do? They take that blood pressure down to normal. They take that blood cholesterol down to normal. They take that blood sugar down to normal. Problem solved. Jorge's good now, right? He doesn't have to worry about it. Is that true? No, unfortunately, I wish it were true because this was the rude awakening for me as an internist. After doing all that training, I come to learn that it's not that effective. And so this research here shows that this is from copious amounts of research, but basically shows that the likelihood of benefit from most of our standard drugs for our chronic diseases, in particular for heart disease, is relatively small. For example, using a blood pressure drug for 5 years, you take that blood pressure drug every day faithfully for 5 years, what's the chances that it's going to do you some good in the form of preventing a heart attack or stroke? About 1.5%. But it's going to about 10% likely to cause harm. So I'm not saying go stop your drugs. I am not saying go stop your drugs, please. But I want us all to be realistic about the value of the drugs. Similar for cholesterol medicines. Another tool in the toolbox, the stent. So the stent is a wire they're going to put in the artery and thread it all the way up to the heart, to the area of blockage, and then they're going to blow up a balloon, and what does that balloon do? Pushes all that plaque out of the way and opens up a passageway, and then they're going to deflate the balloon and pull it out and leave behind this wire mesh that keeps the whole thing open. It's a marvelous concept. There it is inside the body. So problem solved. Jorge's going to get a stent, open it up. He can ride off into the sunset, right? If only it were. Here again, the rude awakening. The research was done. Those pesky researchers keep doing this research and showing that our profit centers, what are we going to do? Close down our heart center now at the hospital? Well, so what we find is there is no survival benefit and there's no benefit for heart attack prevention when we do the stent as we normally do it, when it's most commonly done in stable angina, like Jorge, right? He's not having a heart attack. We're clear on that. Let me be clear, if you're having a heart attack, a stent's another matter. You probably want it. You probably want that stent. It could well save your life. But for stable angina, chronic situation, and this is the meta-analysis, we docs geek out on the meta-analysis, but this basically tells you the whole picture. What have we learned about stents? And this is all 8 studies done of randomizing people to stent or no stent, and they found that there's no significant, no benefit for overall survival, no benefit for risk of a heart attack, and no benefit for subsequently needing coronary bypass surgery. So, I mean, is this news? Who's this news to? Everybody in this room knew that information already? Okay. So heart stents are useless for most stable patients. So if you read the New York Times, you would probably already know this, right? But they're still widely used, and that's a whole other lecture. We're not going to get into why that's the case, but then they said, well, okay, we'll keep doing stents because they prevent chest pain and people have better quality of life. So then this amazing study, Orbita, was done, and they double-blinded you. You either got the stent or you got the fake stent. So they faked the whole thing, and then you walked out of the cath lab, and you didn't know if you had it or not, and they followed you for 2 years, and they figured out if you're having chest pain or not. There's no difference. So it doesn't even prevent chest pain. Unbelievable, says the New York Times. And is this the last nail in the coffin for stenting for stable angina, asks this editorialist in The Lancet. Another tool in the toolbox is coronary artery bypass surgery, where they cut open the chest and they slice you up and get a vein out or an artery out of leg or arm or chest and bypass the blockage. Yet another wonderful technique, a marvel of modern science, and it can save some lives. About 4% of people who go through the coronary bypass surgery, it extends life, usually by a matter of months to a few years. And a 10% reduction, is a maximum 10% reduction in rate of non-fatal heart attacks, which is great, but it comes at the cost of very serious side effects. 1.2% of people die either on the operating table or in the days following the surgery. A good 1% of people have a stroke, and there's a significant problem. Probably the biggest problem is a cognitive problem. It's about 1/5 to 1/3 of people have long-term memory problems. It appears to do brain damage to be on that heart-lung machine. So the take-home message with the tools in the toolbox of not just the cardiologist, I'm not picking on that specialty, I guess I am, but I don't intend to pick on that specialty, allopathic medicine in general with respect to heart diseases, is that we have limitations in how effective these things are. If it's an emergency, they're your man or your woman. But if it's not an emergency, we maybe could do better, and I encourage you to ask those hard questions and maybe get that second opinion before you go forward with that bypass or that stent. Dr. Kim Williams, past president of the American College of Cardiology, has said there are 2 kinds of cardiologists, the vegans and those who haven't read the data. I would say that cardiologists might not be preaching this message because it's not their job. And they're not educated in it. 2 reasons. If you're not going to teach them how to do it and you're not going to pay them to do it, they're not going to do it, right? No surprise. So what is Jorge going to do? He's worried, like, is this my fate? Am I just going to live this way for the rest of my life? Is heart disease my fate? Well, we know from population studies that there are populations who don't get any heart disease, and so we have very strong indicators that it has to do with the lifestyle. In particular, maybe the saturated fat intake. So if you look at Crete in the early 20th century, very low rates of heart disease versus parts of Finland or the United States where there's much higher risk. We know from other studies like these large-scale longitudinal prospective trials like EPIC, where you follow people for decades and you survey them about what they're eating, and you discover that the more healthy lifestyle factors that a patient has in their life, you see that rate of heart disease going down in the second set of bar graphs there, versus, and similar for everything else, by the way. So these healthy lifestyle factors in this particular case were half hour of exercise a day, don't smoke, don't be obese, easier said than done, right? And eat more fruits and vegetables. So maybe he should see a lifestyle medicine doc instead, right? Maybe that's where he should head. And what is in the toolbox ACLM stands for American College of Lifestyle Medicine. So maybe what we have to offer in our toolbox might be of a little more help. So our toolbox looks like this. We have exercise, we have the whole food plant-based diet, we have mindfulness meditation, we have sleeping 8 hours, we have social relationships, connectiveness, and love, and we also have drugs. But we're a little more realistic about the drugs, and we don't reach for them step one, do we? So, all these things, there's copious research saying that all these factors that I just listed can significantly lead you to having that healthier heart. Whereas so many of the things that are sort of baked into our society lead us to more heart disease, unfortunately. That standard American diet is absolutely atherogenic. Being seated in front of the TV, not getting adequate sleep, that chronic distress that we often are put through in our crazy lives, and then loneliness, all being important factors. So one of the people who did some of the landmark research here, Dr. Dean Ornish, the other two presenters have mentioned Dr. Ornish. This is from the same paper that Dr. Bernard shared, showing that over time we see that blockage in the black dots, that line going up, versus the open dots, the line going down. That basically means that line going up means the blockage is getting worse year on year, and that's the natural trend for people with heart disease, and which is basically all of us, is that blockage gets worse year by year by year unless you start doing something that's heart healthy and really change the game. And we see a dramatic reduction in events for people who were randomized to Dr. Ornish's intervention. We'll talk a bit more about what was his intervention. He and his wife have written a book recently called Undo It. I highly recommend it. Great book, great book. And the fact, he's also featured in this documentary, Eating You Alive, which will be showing in this very location 6 days from now. Come on back for that. That's our 5th heart healthy tip. Come watch Eating You Alive, a great documentary, and watch some of these other documentaries. So many great documentaries out there. What are some good documentaries that people can watch? Forks Over Knives. What the Health? Game Changers. Oh my goodness, that is so well done. Yes. Cowspiracy. Fast Food Nation. Plant Pure Nation. Thank you. That's a good one. Who watched Game Changers, by the way? Oh wow, everybody! Oh come on, get out of here! This is all ringers. Are you kidding me? So these are the factors of the Ornish program. It says eat more. I can't even read. What does he say? Love, eat well, move more, stress less, love more. I am embarrassed that I couldn't even remember that. And he's got a program called Undo It, or the Ornish Intensive Cardiac Rehab Program, or Ornish Lifestyle Medicine. I'll talk more about that in just a second. But this program has actually been studied by Highmark and by others, and they find, my goodness, when people have gone through this program, we've cut the rate of hospitalization by like 80%, 90%, and the rate of emergency room visits by like by as much as 50%. And they cut the cost. The people who went through the program cost half the amount after they've gone through the program. And there's some compelling data from the Mutual of Omaha too, who've done similar analysis. So this program's available to all of us. There's 2 locations now in the state of Delaware offering this Ornish program. The one just opened up near Christiana Hospital on the left in Newcastle County. The one down at Beebe Hospital has been in operation for a long time. So if you qualify for this, and a lot of you have insurance that would pay for it if you qualify. Who qualifies? It's people who basically have heart disease, have known blockage, known coronary disease, a history of stent, a history of bypass surgery, a history of a heart attack, or even certain arrhythmias and certain valvular heart disease qualify. But if you qualify, this might well be worth your time. It's an intensive 72 hours over 9 weeks, but the results for this thing are phenomenal. So what I would call this is a high-dose lifestyle medicine program. Low dose is if you come see us every 3 months and we have a half-hour visit and we get to spend 10, 15 minutes talking to you about the diet and food and how's that going. High dose is you go do an Ornish program, or maybe you come to our Cure Diabetes program, something like that. So back to our lifestyle factor. So the other tip I would say is identify those areas where you can build a healthier lifestyle for yourself. We are not good accountants on how healthy we are. If you ask, when we ask people in the office, you know, do you eat a healthy diet? What do they say, Jake? Yeah. And you say, well, what do you eat? And they say, chicken, fish, not much red meat, right? Everybody eats a healthy diet, right? It's that easy. Nobody's eating a healthy diet, okay? And most people aren't exercising enough, half hour a day, basically moderate intensity exercise, 150 minutes a week. Are you really sleeping 8 hours? Do you really have a daily mindfulness practice of some kind? Meditation, yoga, whatever it might be. Are you connected to people adequately? So identify those areas. I want to call out loneliness. It's getting increasing recognition, and this meta-analysis found that there was a 29% increased rate of heart disease in people who have fewer social connections. Look at the poor guy, he's off in the corner, he's so lonely. You just want to help him out, right? What are some things we can do to build more relationships, a healthier lifestyle? So building those caring relationships, our next heart healthy tip. Think about this like a muscle, right? Just like you build muscle, you build relationships with people. You have to work at it, right? What are some things that research has found compel us to do more of that kind of activity? Mindfulness meditation is one. Never underestimate the power of a gratitude journal. The gratitude journal can do it too. There's positive psychology techniques. It's beyond the scope of this lecture to get into all that stuff, but build caring relationships. I want to call out sedentation. I like to recommend to my patients, get you one of them, okay? $120 now, and they say, oh, there's no space in my living room for it. No, that's the most important piece of furniture in your house. Make space for it. So if you're watching TV, you're pedaling, okay, or something like that. Treadmill, whatever it might be. Sitting is just that bad for you. You have to engineer your living environment to get the sitting out of there. So the exercise bike is our 9th heart healthy tip. And I would be remiss if I did not call out the diet. Diet is absolutely vital for heart disease, okay? Those wonderful whole food, plant-based diet foods are absolutely healing. And the foods that are so commonplace, and it's like fingers on the chalkboard to watch people eat out in the wild, because it's so atherogenic what people put in their mouths on a routine basis and what we feed our children. But don't get me started on that topic, because you'll have to drag me off the stage. But there are some who have argued that atherosclerosis, that high cholesterol is the only risk factor, in a sense. And the argument has been made that you cannot develop cardiovascular disease or vascular disease without high cholesterol. If you have low cholesterol and you're a smoker and diabetes and high blood pressure and everything else, you can't develop heart disease. I'm not sure that study's been completely done, but that's the theory, and there is some credibility there. The person who really demonstrated the power of diet is Dr. Caldwell Esselstyn. So he's featured in his famous book, Prevent and Reverse Heart Disease, and the famous documentary Forks Over Knives. And apologies that we're showing the same graphic, but this is just from his famous paper. He's got multiple other graphics. It's not just the one guy whose angiogram shows that the blockage is reversed. But he basically took a population of 198 people with severe coronary disease and was able to reverse it in the majority. And he was able to halt the progression of the disease, where almost none of the people who went through, only 2 people who went through his program went on to have heart attack, went on to have a stroke, or went on to have coronary bypass surgery. Everybody else, no further events. And you did have these findings of the reversal of the blockage. And we all highlight this. Why do we all highlight the same studies, Ornish, Esselstyn? Because they're the ones who showed you could reverse blockage. And nobody else has done it. Wasn't done with paleo, wasn't done with Mediterranean, wasn't done with anything else. So this is what the best that research has discovered on how we can prevent heart disease. So, but what Ornish has done is, in particular, he really emphasizes low fat. And I want to emphasize what Ornish did is just, his intervention was just dietary. He didn't say anything about exercise or meditation or any of that. He said, just eat this diet. It's completely vegan, and it's completely, as he says, no oil. And he does that. He gets on stage and says, no oil. Okay, he's very anti-oil. He also minimizes nuts. So this is not to say everybody should be doing this, because I think it's healthy to eat nuts. But if your goal is to reverse heart disease, if you're a heart patient, if you're someone who has angina, like our friend Jorge, I would say the Esselstyn-style diet would probably be a very good strategy. I like to emphasize in my practice fiber, and we heard about fiber earlier, and for me it's just simple, just eat more fiber. So I call myself Dr. Fiber. The more fiber we eat, the less disease we get of almost any kind. I mean, the less heart disease you get, the less diabetes you get. And some of you have heard me say this so many times, I do apologize. Does that mean I'm over time? Okay, I got 5 minutes. All right. It's red, so I thought, oh my God, what have I done? Ruined everybody's day. So the less breast cancer we get, as we learned earlier, what a great talk about cancer. I learned some great stuff. But the less prostate cancer, the less Alzheimer's dementia we get, and the longer we live, right? So eat that fiber. My goodness, it's wonderful. Boost dietary fiber is our 11th heart healthy tip. So in summary, we have, in my opinion, much stronger evidence in favor of the lifestyle interventions than in favor of the allopathic, regular medical intervention. So look at that orange versus that orange. You've got for a stent for non-emergent coronary blockage. What's the value proposition? 0% chance of benefit, 2% chance of harm, like dying on the operating table. That's close, right? Versus the orange intensive cardiac rehab, according to their data and according to the Mutual of Omaha data, 80% reduction in the need to go on and get that stent or that bypass surgery. 80%. Okay? And what's the risk? I mean, you might get in a car accident driving there or something like that, right? Or indigest, I don't know, too much gas. Your wife might kick you out of bed and sleep in the other room. Statins for primary prevention of heart disease, a 1% chance of benefit at 5 years, a 10% chance of harm. Statins seem to increase our rate of diabetes by 30 to 40%. So there's a downside to statin. I'm not anti-statin. Statins do reduce heart attacks. Don't stop your statin without the advice of your doctor. But even the wimpy Mediterranean diet outperforms statins with a 2% reduction in risk of heart disease or strokes at 5 years. So we can do better than allopathic medicine, in my opinion.